Good morning, everyone. Thanks so much for being here. I am Marsha Thorson, and I have been a practice manager for 2 separate independent family practice clinics in rural Colorado for the past 15 years. Unfortunately, both of these practices, like so many others across our state and nation, have been ground down by administrivia and have closed. The administrative requirements to provide health care, particularly primary care within our current healthcare system in America, is unsustainable. Requirements such as necessary documentation for visits, care coordination, pre-authorization submissions and peer reviews, paperwork for patients' needs, such as child care forms, sports physical forms, insurance discount forms for patients, employer-based administrative fitness exams, and on and on. Finding the correct codes or code out of thousands available for orders and claim forms and modifiers and all of those things, maintenance of licensure and continuing medical education requirements, and reporting demands reduce time for patients to actually be seen. More time, then, is required to find different codes or add additional documentation for orders, pre-authorizations, claim forms, provider disputes and appeals of denials based on requests from insurance companies, hospitals, and even patients because they were upset their insurance didn't pay for their care. So more time then is spent eaten up explaining to patients why codes just can't simply be changed so that they can get their service paid for by their insurance company. That's called fraud. Pre-authorizations and denials are through the roof. This has just been exponential over the past 15 years. These cause delays and are rationed care at the discretion of the insurance company's algorithm, and they do cause harm to patients and their care team. Yes, the provider, the clinician, but also the front-end staff, the middle staff who are working on these pre-authorizations and talking with the patients. It causes harm. By the way, all of this is completely uncompensated and unbillable time. Research has shown, and Dr. Anthony talked about this when she spoke, physicians need 27 hours a day to provide all of the guideline-based care and associated documentation and paperwork completion for their panel of patients. That's right, 27 hours a day is what the research shows. Perhaps AI has dipped in and it's dropped down an hour to 26. I'm not sure. It is no wonder that physicians are experiencing moral injury, burnout, are leaving the field, are suicidal, and primary care residency slots go unfilled, exacerbating the crisis we're facing of primary care shortages that exist. Of note, in the past 10 months in Colorado, 4 primary care offices and 4 specialty practices have permanently closed, and a rural regional hospital has ceased OB services as of April this year. I'm sure there's more. These practices are across our state. They're in rural and urban areas: Gunnison, Crested Butte, Grand Junction, Pueblo, Trinidad, Pagosa Springs, Denver, Loveland, and La Junta. The rural clinics were independently owned. The Loveland practice, which was a family practice, they had already sold out to Optum, which is, by the way, owned by United Healthcare, a corporate conglomerate, and even they still couldn't keep those doors open. The specialty practices were urologists, ophthalmologists, orthopedics. And the La Junta Hospital, they are the ones who did obstetrics. None of these groups could even maintain that administrative burden. But wait, there's more administrivia. Many insurers require annual, quarterly, or monthly reporting for various metrics. If we miss the clicks, or we don't have an EHR that can pull that very specific report, we get financially penalized. Even though we're doing the work and we can show we're doing the work because it's not in the way that they want to see it, we get financially penalized. And we're also balancing all sorts of different models at once: fee-for-service, value-based payment like ACOs, risk-based payments like capitation, We're being penalized. And then we're forced to write reports and corrective action plans to explain why we aren't meeting the metrics set out by the insurer. Also, all uncompensated. The fact is primary care is continuing to be pressured and ground down to do more for less. All insurers, public and private, are paying less and less for primary care. This is not new. This has been the trend for the past 20 years, and it will continue. Moral injury is across the board, affecting everyone in the clinic. We're all just trying so hard every day to take care of our patients and do the very best we can. And the American healthcare system is 100% making it impossible. The suicide rate among physicians in the United States is 300 to 400 per year. That is unacceptable. I don't know how anybody can feel that that is acceptable on any level. Where will we land if we have no healers left? Moral injury is real, and we need to recognize it and acknowledge it. And most importantly, we must do something about it. Sweeping it under the rug and ignoring it is not the answer. There has to be a better way. So my question to everyone here and everyone that you know is, are we brave enough to change the system? Are we ready? That's my question. Are we ready? Let's do this!